I'm Joanne Sanchez. We welcome you again to this week's edition of Your Active Life, your orthopedic educational community program. We would like to thank Affectionate Home Care for helping make this program possible. Here with me again, Dr. Raul Marquez. Hello,
hi,
Dr.
Joanne.
Marquez.
And hi, everybody. Thank you for joining us today.
Our goal during this program is to provide valuable healthcare information that will help you and your family maintain an active life. According to the American Academy of the Orthopedic Surgeons, nearly 2 million people complain of knee pain every year. There are various causes of knee pain, and on today's program, Dr. Marquez will be discussing a common cause mostly found in adults known as arthritis. In particular, he will be discussing osteoarthritis and available treatments. Dr. Marquez will also be taking us into the operating room. We ask for viewer discretion.
I'd like to begin by first explaining what arthritis is. There are more than 100 types of arthritis. Arthritis signifies pain, swelling, redness of the joint. In simple terms, it means joint inflammation. The most common form of arthritis affecting approximately 21 million Americans is arthritis, is osteoarthritis. Osteoarthritis is also the most common form of knee arthritis. It's usually a slow, progressive, degenerative disease in which the joint and cartilage gradually wears away. It is a wear and tear type of condition. Patients affected by osteoarthritis tend to be middle-aged or older.
Dr. Marquez, is arthritis hereditary?
No, it is not. However, having certain hereditary conditions, including defective cartilage and malformation of the joints, may increase the risk of osteoarthritis. The exact cause of osteoarthritis are unclear. Women of age 45 and older have a higher risk than males. Factors that can increase the risk of arthritis are caused by example of excessive physical activity or sport diseases that can change the structure and function of the articular cartilage, such as rheumatoid arthritis. Weak thigh muscles and also being overweight are also factors that can increase the risk of osteoarthritis and increase the symptoms as well.
Are there any cures for arthritis?
There is no cure for this disease, but available treatment can relieve pain and help you remain active. Your doctor may diagnose arthritis by doing a physical examination that focuses on range of motion while you're walking. We examine the joints for swelling and tenderness, as well as taking x-rays will be required to make the diagnosis of arthritis. Typically, they'll show a loss of joint space in the affected knee on x-rays. Today, I will share a case associated with osteoarthritis. My patient is a 63-year-old female who came to the office due to a severe knee pain. She unfortunately had not responded to conservative treatment, including, or conservative treatment meaning failing the treatment with analgesics, anti-inflammatory medication, physical therapy, rest, exercises. It came to the point that she could not tolerate the pain anymore. So unfortunately, we had to perform a surgery on the patient.
Going to show us what it really is like in the operating room.
In this scene is just to show you how we put the receivers. The receivers basically electrodes that we connect in the bone in the proximal part and the distal part, that means above and below the knee, so we can have the exact measurements for this patient's surgery. And at this point we place small little screws right into the bone. This just show to demonstrate how we place them.
Dr. Marquez, what are the transmitters for?
Well, the transmitters have the specific purpose of giving us the signal that is going to measure the very precise amount of cartilage or bone that we need to resect. Are like the guides for the computer. In this scene also, you see the two transmitters, one above and one below, and we gotta make sure that in the correct position. And once we have that, the correct position of the transmitters, that we can start the surgery. By the correct position means that we have what we call a green signal, and what you're going to see in a few seconds is a small incision. And as you can see, I'm demonstrating with my fingers the length of the incision. And again, we mentioned this is a small incision for this type of surgery because we're putting a knee replacement through that small incision. And with other techniques, the incision is almost 2 or 3 times as long. That way, by making the small incision, we first of all, we respect a lot of the tissues. We have less ligament damage and less chance of bleeding, as well as less chance of swelling, so the patient can recuperate faster. This is an X-ray of the knee. The upper part is the thigh bone, and then we have the leg bone. And normally we have a space in between those two structures we call the cartilage. In her case, you can see they're basically bone on bone. And that's what we're trying to do. We're going to remove only the damage, the articular cartilage that is damaged. As we have explained before, total joint replacement people are afraid of this operation because they think we just cut the bone and put a new joint, which is not true. Basically, what we do is we take or we saw away the articular cartilage, and we substitute that for the metal and plastic. Now, what we're looking at here is you can see there's a pointer on my right hand, and then you have the computer on the bottom part of the image the image here, and everybody has to coordinate this. I had to point to the right place. The computer will take those measurements, and in certain ways, this surgery to me is very simple because what we're doing now is the computer is telling us what's the next step. You can see in the image, you can see the image of a leg is and exactly the type of movement I need to do. Here is, for example, a very, very important part where you're looking at the monitor and we are mapping or capturing the image of the center of the hip.
How many surgeries have you done with this technology?
Well, with this specific technology, we've done more than 150 of these operations, and very happy to report that they've been very successful, and I'm very proud to say that we have the most experience in the state of Texas performing this surgery. Now we are really we are measuring now what we call the slope or the curvature of the thigh bone. You can see in the image in the computer the shape of the thigh bone, and it's important for us to put it at 0 degrees, and we measure exactly how much worn-out cartilage on one side versus the other side, and that allows us to calculate and allows also the computer to calculate what's the ideal measurements, well, the ideal rotation on which way we're going to put this prosthesis in. In this case, basically what we're looking at is the center of the ankle, and most important, the dynamic center of the ankle, not just the static center of the ankle. In this image, we're looking at the center of the ankle, and we go back and forth until we have the very precise movements on the computer. It's just like the old carpenter. You measure 3 times and cut it only once, so you don't have to. The more you measure, the more precise your cut is going to be.